Aloha, everybody. Today is Tuesday, September 22nd. My name is Alex Landry. I am the National Health Federation's video host and our political watchdog. I am elated today for our special guest, Sara, who is the Secretary of NHF Sweden. And today she is going to cover a report that we were talking about last week at our NHF board meeting. And I was so inspired that I felt like I needed to do a video report on this important topic and issue. So how you doing today, Sara?
I'm doing just fine, thank you.
Excellent. It's really nice to see you, and it's always special when we're able to coordinate with all these different time zones. So you're in Sweden, I'm over here in Florida, so let's get this important report to the people and to all of our NHF members and various viewers and subscribers to our YouTube channel.
Yes. And what I wanted to talk about it is that the Norwegian Food Safety Authority proposes to set new special Norwegian maximum limits for vitamin E, vitamin B6, iron, and zinc in the dietary supplement regulation. And at the same time, they want to have specific labeling requirements for those vitamins and minerals. One can think, why are they doing this? And the purpose is that they want to ensure that the food supplements with vitamin E, B6, iron, and zinc are safe. So it's a safe issue. This actually started in 2017 in June, when Norway adopted new special maximum limits for folic acid, magnesium, calcium, vitamin C, and vitamin D. And at that time, they also had 4 different categories of ages. So they have one category from 0 to 3 years, and from 3 years to 11 years, and then adolescents and then adults. So they have maximum limits for each category. So it's really weird. Sweden also have started to do this and have a draft regulation, but they have not different ages. What they have to do in order to it could be adopted in the nation is that each nation, if they want to have regulation that is different from the EU regulation, they have to apply at the EU Commission. So then everyone, different countries and organizations, they can give their opinion on it. So that's it was Norway have done. And actually they have succeeded, as I said, in 2017. And I didn't know about it at that time, so this is new to me. So now I want us to stop this, because it is not allowed. I mean, it violates the EU rights, and it also violates different covenants, international covenants. I did this research in April this year for Sweden, because then our Swedish food agency, they had a proposed legislation about this. And I did a 55 pages report about this, how it violates different laws, and also the scientific evidence. I also
compiled her.
Yes.
Thank you. So what you're saying, what you've discovered recently is somewhat of a continuation of what you were investigating or researching back in April?
I can read the summary I did in April if you want to.
I think that would
because I said it's 55 pages and it's really hot stuff in there. But I wrote, Sweden should not introduce maximum doses as such a procedure not only violates the EU law, but also violates a number of international conventions, not at least Article 12 of the International Covenant on Economic, Social and Cultural Rights, which give people the right to the highest attainable standard of health. We have that right. Thus, citizens must not be deprived of the products that enable them to achieve the highest attainable standard of health. The restrictions are also contrary to the EU law and to the EU Dietary Supplement Directive. In addition, the Swedish Food Agency has not fulfilled the requisite of necessity, as the studies and the scientific basis for the proposed restrictions are extremely substandard. The authority has also not undertaken an adequate proportionality assessment, which is required for restrictions of this type. Furthermore, this type of measure is discriminatory both for Swedish dietary supplement companies and also for Swedish consumers. In addition, the Swedish Food Agency has not followed what is stipulated in the authority's own impact assessment. So they are really violating our rights.
Mm-hmm.
Well,
thank you for that eloquent summary of your 55-page report.
Yes, it's if I should have all the details about it, but it's funny reading sometimes because they are so out, and sometimes you don't think they really can write what they are writing.
Yeah. Mm-hmm.
Yeah.
What? Do you have anything else to comment on with that? I was about to.
Yes, that is about Norway. Actually, Sweden did the same thing, but they are saying that the Norwegian Food Safety Authority believes that in accordance with the EU law, in certain cases, one can determine maximum limits for the entire population based on what the most vulnerable group endures. And I think that is not the EU right. That's not what you, because the EU rights is about that all products in EU that are manufactured within EU, they are able to travel all around EU. But when they have those regulations, the products in Norway, or the products that are manufactured elsewhere but Norway, they cannot travel into Norway because that country has restrictions. So that is contrary to the EU regulation. And also, as I said, we have the right to the highest attainable health, standard of health. And then we're supposed to be able to buy the products that we think are beneficial for us, for our health. But they are trying to, I don't know, because in Sweden, if they want to regulate, one thing that then they should take the general population and try to make safe values for the general people, but they are not. They are taking, when they have made these limits, they take the 5 percentile that eat the best food, that they have the best nutrition, and they calculated for them to not have too much nutrients. So the values is based on those who eat the best food. Did you copy that? Did you understand that? Because I think that products, health products, should be it should be possible to buy products if you have a bad health, if you have malabsorptions, or anyhow you want to have a better health. So then I need supplements with higher doses, but they restrict the maximum doses, so it will be applied to those people that eat the best food and get the most nutrients from the food already. And that I think they think wrong, and it couldn't be in that way. It shouldn't be that way.
Good thing you've been investigating this very thoroughly.
Yeah.
Because
And the scientific evidence they have for this is like zero. They don't have, because what they should do is a risk analysis and see what in what way are people hurt now and how many, and is that enough to make a regulation about it? But they do not. They just look at the scientific studies and pick out some of them. It's cherry picking, really.
cherry pick, yeah. Mm-hmm.
Yes. And then they sometimes they have the dose, and then they have what do you call that? Just to be on the safe side, they are lowering it.
Mm-hmm.
Okay, so the science report said you can have this value, but just to be safe, they reduce the value anyway.
Well, earlier, I don't want to interrupt you. I've been wanting to tie in Codex Alimentarius.
Yeah.
Because I'm, basically, it's not like that's not at the forefront of the National Health Federation right now. It's just some of these Codex Alimentarius meetings have been postponed, or they're virtual right now. And so the investigative work you're doing seems to parallel with the Codex work. So with Norway, is there something going on?
Actually, one can say that, and I have a funny story about this, because we wanted to be what you call that? I actually, in my dictionary, it says body considering proposed legislation. Do you understand that?
Mm-hmm.
To be a body considering proposed legislation, to be a registered body. And we asked the Swedish Food Agency that we wanted to be a registered body for their legislation. And they said no. And I said, but we really want it, because we can't look on your webpage every day to see when it comes there. We really want it to be sent to us. So please let us be registered, because then they have to send it by mail to us. And they said no. So then I said that I have a question for them. And I asked them that Scott Tips, that is the president of NHF, and NHF has the authority to speak out on the Codex Alimentarius meetings. So NHF is our mother organization. So why are not NHF Sweden, where Scott Tips is the president also, why are we not allowed to have this debate at the national level? And she just said, okay, I put you up on the list.
There you go.
Yes.
That's good.
So and they really did. They did send this proposal to us so we could answer. And it was these 55 pages I wrote.
Excellent. Well, just real quick, I'd like a moment to ask everybody who's tuning into this right now to please subscribe to our NHF YouTube channel. We're working really hard on passing that 1,000 subscriber milestone. So please help us by liking, subscribing, and sharing this video. And then what's the main actions you recommend people take right now? Is there a campaign that's live right now for this? How can we stop this? Or what's the plan of action right now?
As I said, that they have to go through the TRIS, what do you call that? As I said, in the EU Commission, have to apply. And I will try to respond to that, because organizations can respond to it. I don't otherwise know. I would like that in Sweden that all manufacturers of health products go together and start to work with the food agency and ask them what they are doing, and that we are not supporting this. And as I said, we have a lot of laws, and we have the scientific evidence and so on. So they're not allowed to do what they are doing. So I would like that manufacturers go together, and organizations and health practitioners and so on.
Yeah. Okay. Well, let's put the intention out. Some of these manufacturers are able to watch this video, or we get some of their contact info or emails. And
Yeah, and it could be good if we it can have all these people together, and because someday they will have maximum doses at the EU level, and then we already have the evidence and laws and scientific evidence, and so a lot of work is already been done and to be ready to fight. But if all manufacturers in EU could do it, it could be good to start to have, as you said, the relationships already.
Mm-hmm. Yeah, and eventually, I just love what you mentioned about optimal health standards. You know, and it's pretty powerful because one thing leads to another. You know, what would it look like for neighborhoods, communities? I mean, even going back to individuals, families that have this optimal health. I mean, this is how we advance our
it's pretty sure that it's actually in that covenant.
Mm-hmm. Excellent. Well, I'm excited. I'm really grateful for your time today and for all the research you've done and the nice, concise summary you provided. And I look forward to collaborating with you on more video
we can do that. I would love to. I have to mention one more thing about Norway. With this doses that they are restricting, so as I said, they have 4 different categories, and zinc, they have 0. It is not allowed to contain any amount of zinc if it's to children between 0 to 11 years old. So, I mean, almost all the supplements have zinc in them. But then all those products will not be allowed in Norway.
And you said from 0 to 11 years old?
Yes.
See, I'm not an expert in this, but how zinc promotes our health and
immune system.
Exactly, and then even more so because generally speaking, I think children tend to have a stronger immune system, or there's some aspects of their immune system that's pretty strong, and then the idea of why no zinc, that can help to fortify.
And I thought they had mistaken. I thought, they have to done something wrong about this, because it said that about calcium, and I think I have.
Do you want to pull up anything? Do you know how to screen share? I was going to say earlier if there was anything you wanted.
No, I don't know, but about calcium. So in the legislation that is today, they say dietary supplements that contain more than maximum daily dose of I'm sorry. No, that was it is dietary supplements that contain more than the maximum daily dose of calcium for adults in 1 measured unit must be labeled "Do not use by adults from 18 years of age." So I was like, how can supplements be not for adults to take? But that's because they have higher maximum limits for those that are 3 years and 11 years old than for adults. So that's why adults can't eat those supplements with calcium.
And I don't want to draw too quick of a conclusion, but it seems like the people drafting these standards, possibly their agenda is selling more pharmaceutical products. So they're thinking, how do we have policies which result in,
yes, I think it's politics.
Instead of the opposite, where if people are healthier, they tend to not need to purchase as many pharmaceuticals. So like I said, I don't want to oversimplify or draw a conclusion too soon, but this seems to be a pattern. And
yes.
Well, how does this work? So if something like this happens in Norway, how does this trickle into the whole rest of Europe, or how?
Yes, that's what I'm concerned about, and that's why I think we really need to make argue in this system, because last time they got through with this, and as you said, if they go through with this also, and then Sweden go through, and then the other countries will just go along. So we have to stop this now.
Mm-hmm. Well, let's do it. We decided to take action with this video report, so now I'm going to work on uploading this and sharing it to our NHF Facebook page, and then I'll share it with you. You can share it through your mediums, and hopefully we'll get a group of people talking about this, and we'll continue the good fight here. But I love it. I love the vision of health standards, because it is nice to think about what humanity could be if we're all thriving and we're all have a good health, and we're able to evolve beyond this whole big pharma, big oil monopoly system, kind of, without getting too dystopian or negative, and the whole issue of chemical additives in our food and other things that's all interfering with our peak health. But we're on it, thanks to I would consider you an investigative journalist, what you're doing, and you've motivated me to look into this a little bit more, because like I mentioned, from my understanding, the Codex Alimentarius, it tends to be a more European thing, and then now with the United States, it seems like defunding the World Health Organization and things like that, there's certain things that seems to be resonating with the health freedom.
But Norway, they are not a citizen, a member state of the EU.
Okay.
But they have the same legislation anyway, because they are in the EES, and also, as you said, Codex Alimentarius. That is a global. When these standards has been taken, then it's applied to 125 countries. So it's not only Europe; it's globally.
Yeah. Mm-hmm.
Yeah.
Exactly. But it's important that you caught this where it is right now, and let's do as much as we can to inform as many people as possible, and to continue inspired video reports like this. And then on another time, possibly I could interview you, and you could share a little of your background, how you discovered the health freedom movement and the National Health Federation, and all the work you do as an author. And it's the NHF Sweden magazine.
Yeah.
Sure. You maybe have you discussed this in the magazine yet?
I write about what we are doing. So yes, I have written about this proposed legislation from the Swedish Food Agency.
Great.
So I try to cover it, but I think that maybe I should put it more on the web also. I now, since we have the magazine, I kind of just share it on the magazine,
Mm-hmm.
but I should share it on the internet as well.
Great. Is there anything else I can do to help with this campaign?
Yeah, I think so. Just let me think about it. I think that you could be it could be very good.
Yeah.
If you can help out, yes.
Excellent. Well, great. Well, thank you for your time. I really appreciate it, and I look forward to collaborating with you.
Thank you so much, Alex.
You're welcome, and thanks to everybody viewing this. Really appreciate it. Help us, spread this information far and wide, and don't forget, smash that notification bell on our YouTube channel so you'll get updated with other video reports and interviews and exclusive content like this. So once again, thank you very much, Sara, and have a great rest of your evening, right? Evening time over there. It's just almost noon.
It's 6 o'clock here.
Well, all right. Well, thanks again.
Thank you. Bye-bye.